Welcome back to my no-name channel, and I'm Bruce, and this is another Bali COVID-19 update for October 29th, 2020. And what do we have today? Well, I have numbers as usual, and then what is it that people are concerned about? Vaccines, and so this is a lot about vaccines today. First up, we have the government canceling a purchase of vaccines, but they still have plans to get vaccines, and we'll talk about that. And don't rush with the vaccines, according to a number of medical organizations in Indonesia, telling government to slow down. And then considerations of sanctions if you don't take the vaccine. This is a controversial one, I'm not sure where that's going. And then e-visas have been started up, make it easier to get visas to come to Indonesia, and then wrap up. And that's it. Pretty quick today. I hope I said that last time, but it turned out to be pretty long. So let's get started with the numbers. Numbers are okay. Still well below 100 recently. 68 new cases yesterday. It gives us a total of 11,588 positives all told. 10,397 recovers. 380 deaths. And we're at 811 active cases. So active cases are pretty much the same as last week. And these are all Indonesians and all Bali residents, all local transmissions. Okay, so nothing new there. And numbers, top three, Denpasar 16, Jembrana 13, and Gianyar 10. And in Indonesia, we passed the 400,000 mark of positive cases. And last week, deaths in Indonesia rose by 18%. So, clearly, still have a problem in Indonesia as a whole. Bali seems to be pretty stable. We're not going up. We're not going all the way down. It can get better. And in Buleleng, the government is going to begin random testing of civil servants, police, and military personnel who frequently interact with the public. And additionally, PCR swab testing will be given to all close contacts who have been identified from contact tracing. So Buleleng is upping the game a little bit. And so, what does that tell us? Well, we're at the cusp of the rainy season starting. I've been sick recently because of this change of season. I always get sick during the change of the season. My son Sam is sick. Well, he didn't say he was, but his mother said he's sick. Granddaughter Zoe has been sick. A lot of kids with colds and flu-like symptoms, not COVID-19. This is the change of the season illness. And so that's where we're at there. Okay, let's get started. And Indonesia cancels purchase of COVID-19 vaccines from AstraZeneca. So the government canceled buying 100 million doses made by the British pharmaceutical company AstraZeneca. The reason is that the company refuses to take responsibility if there's a failure of production of the vaccine by mid-2021. And Indonesia was asked for a down payment of $250 million. And this was going to be used in part to build a production facility in Thailand. Why aren't they building one here? We can make vaccines here, according to a previous report. And Indonesia is also not buying from the pharmaceutical companies CanSino and Sinopharm. CanSino's vaccine has been given to the Chinese military on an emergency basis, so the People's Army has been taking this. And the company has not gone through their third phase yet, and the government wants to get the third phase clinical trials in Indonesia. While the government is not buying the vaccine at this point, it's still under consideration from CanSino. But they don't want to buy from Sinopharma because the cost is too high. It's reported that it's at $22 per dose. Another company, with the government's planned purchase of 3 million doses from Sinovac Biotech, and the price there would be around $14 per dose. Now, a team consisting of people from PT Biopharma, and they're the people that have said that they could eventually start producing doses here. The Food and Drug Supervisory Agency, and the Ministry of Health, and, get this, the Ministry of Religion, flew to China to review the Sinovac Biotech factory and analyze the results of the third phase of the clinical trials. So, okay, that makes sense. They're thinking about buying this. They want to go and see what's going on. Why the Ministry of Religion? Because the government apparently has to make sure that this is going to be a halal version. This is where religion and science is mixing. Not the place to do that. But this is Indonesia. And the Ministry of Health was following Jokowi's recommendation that the vaccine process won't be rushed, supposedly. However, Jokowi commented that he wanted a good communication with the public surrounding the vaccine so that situation doesn't arise like arisen with the job creation law, where we've had demonstrations in various parts of the country leading to some riots in Jakarta and some street battles in Bali, not widely reported internationally for obvious reasons. The 3 million doses from Sinovac will only be for medical personnel. So they're going to take this. This is a 2-dose vaccine. So they're going to get 3 million doses, which means this 1.5 million people will receive the vaccine. And this is to occur in mid-November. So just a few weeks from now. And health workers must be between 19 and 59 and not have any problems, any health problems that would interfere with the vaccine. So they're going to give it to a health personnel. So what happens if this is not a good vaccine? If there's some problem with the vaccine, we're going to get rid of the doctors, the nurses, the dentists, lab technicians. Okay. So the clinical trial of the third phase of Sinovac is still ongoing in Bandung and is planned to be completed in January 2021. And I heard from a friend of mine in Brazil that the Brazilian government has broken off their trials there. They no longer want to work with the Chinese, according to my friend, on the vaccine. The president doesn't trust what's going on there. So the plan is that the clinical trials are going to be completed by January 2021, and there will be 13 million doses of vaccines to be produced in Indonesia by Biopharma. So the plan is to, right, what's the plan? Let's get this. At this stage, right now, there's going to be 1.5 million people, medical personnel first, who are going to be vaccinated in another 2, 3, 4 weeks, depending on how things work out. And then by January, let's say late January of 2021, there will be another 13 million doses, and people will start getting vaccinated around the country. Now, this is obviously an ongoing situation. But the number of medical associations, including the Indonesian Medical Association, the Indonesian Society of Internal Medicine, and the Indonesian Society of Respirology, have all strongly cautioned the government to go slow with vaccines. They say not to rush the vaccination program, but wait for the results of the trial to be published. Regardless of that, the government has this team in China right now. And according to Ahmed Yuryanto, the Health Ministry's Director General for Disease Control and Prevention, he claimed that the three Chinese firms, Sinovac, Sinopharm, and Sinobio, have already completed their trials. Well, in fact, that they haven't. This has been questioned by reports from Canada, from Turkey, and from Brazil, who said that these are not, the third phase is not completed. So the Bandung trial is still underway. The plan seems at this point to get emergency use authorization based on Food and Drug Monitoring Agency here, on their recommendation and on the approval from the Indonesian Ulama Council, MUI, not my favorite organization, certifying that the vaccine is halal. According to the BPOM, that's the Food and Drug Monitoring Agency, Director Lucia Rizka Andalusia, the BPOM will only authorize emergency use if the benefits outweigh the risk. Okay. And she said, we're out working with scientists. Everything is going to be above board, and this is going to go by science, and so we will only start vaccinating people if the vaccines are safe. But if you look at the history of the development of vaccines, this one has been rushed, but really rushed. How many people are going to want to take the vaccine? This is a question around the world. The people are asking around the world. Who is going to be taking the vaccine? In another story, regions may sanction anti-vaxxers. So regional administrations are considering issuing bylaws to sanction people who refuse to be vaccinated. West Java Governor Ridwan Kamil has instructed his staff to look into the legality of such bylaws. He added that community awareness programs are already being intensified to educate the population about the vaccine, its use, and its safety. The Jakarta administration has already issued, according to a report down below, that stipulates sanctions for anti-vaxxers. Article 30 of the bylaw stipulates anyone deliberately refusing treatment or vaccination will be subject to a fine of 5 million rupiahs. The central government plans to secure emergency authorization as soon as possible and roll out the vaccination program in January 2021. So, I don't know where this story is going. This story came out a few days ago, and like I said, usual, all the links are below. So what does this mean? Everybody is going to be forced to take the vaccine, whether or not they want to, whether or not they believe in it, whether or not we know that it's safe. These are all questions that still need to be answered. Right now, the medical professionals in Indonesia are saying, slow down. Let's take a look at things. We do have a problem here, but we're far from the worst off in the world right now. You take a look at what's happening in Europe, what's happening in the U.S. Korea, for example, is going to go slow, but they're having their own problems. They have a regular flu vaccine. The flu season started here, and they had some problems with a number of deaths after people had taken the flu vaccine. There's been no correlation, as far as I know, as of yesterday between the vaccinations for the flu and the deaths, but that's still being studied. So there are a lot of questions. We'll keep looking at this closely. And e-visas. Okay, good news. For those that want to come to Bali, e-visas started for foreign visitors, and there is a website that you can go to, be a link down below, visaonline.imigracy.go.id. I'll put it down below. And you can look at what you need to do to register online. The e-visas will be issued to foreigners who wish to enter Indonesia. The Law and Human Rights Minister said that the e-visa will create a faster, easier, and more transparent entry permit service. She also added that this is a message to foreign investors that Indonesia is reforming its bureaucracy and is ready for foreign investment. So, if you want to come, okay. And what's happening so far? No tourist visas issued, still saying the end of the year, which is getting closer, right? 2 months away. As I mentioned several other times, I've got a feeling that they'll open at Christmas time, but I wouldn't bank on it. I wouldn't bank on anything here right now. But I've got a feeling that they would want to. If they're going to open, say, mid-January, why not open in mid-December and get the Christmas, New Year's people? I don't know. We'll see what's happening. And there are people coming in on the business visa, the B211, and I had a link on the last COVID-19 update about that. And so people are finding ways to get in here, but these are people that are coming in, they're paying some money. These are not just people who want to bounce in for a week or two and then bounce out. So that kind of tourism is not happening. People that are expecting to stay here for a longer term are managing to come in on the business visas, which are apparently being issued on a regular basis. So, if you're an Aussie, I had a question before, some people are getting exemptions from the Australian government. Apparently, one thing I read on social media today was that you have to be gone for 3 months and have some reason, so you have to explain why you need to go there. So, some people are here, and what are things like? Okay, rainy season is coming, so this isn't the best time of the year to be here, obviously, but it's Indonesia, it's the tropics. Like today, it was bright, brilliantly sunny in the morning. It's kind of clouding up now. The wind is picking up again, but this morning it was absolutely beautiful, kayaking weather, and I have a hip problem. I don't know, I can't walk, so I checked with my doctor in Seoul last night, and he gave me a series of things that I can do, and hopefully I will be up and around in a few days. This is part of getting old, I guess. And then I'm looking forward to getting out and kayaking with Zoe. And so that's it. Thanks for viewing. Follow safety procedures, protocols, wherever you are. If you want to come to Bali, I hope you get here. And next time I want to talk about the latest controversy in Indonesia, and this is not related to Bali per se, but to tourism with the Jurassic Park and the Komodo dragons. Just saw a brand new article, just came out, some new information this morning, and here's the picture that has set this controversy off. Okay, be kind to someone. Thanks for visiting. Leave a comment below if you like if you like. See you next time.